Colm Henry, he's National Clinical Advisor and Programme Lead for Acute Hospitals with the HSE, joins us now. Colm, thank you very much for joining us on the programme. You can almost set your clock to this hospital overcrowding story. More beds and more staff, principally consultants. If we tackled these two things, could we possibly avoid being in this position and doing this interview this time next year?
And Sharon, first of all, I'd like to welcome the fact that there has been a reduction in trolleys today, but it's still unacceptable that people are waiting so long in trolleys, particularly vulnerable groups, older people and children. And we all need to redouble our efforts to support them and support our frontline staff who are working under sometimes very trying circumstances.
So do we need more consultants? Because the Association of Emergency Medicine says we do.
Well, the problem of overcrowding the emergency departments is not just confined to emergency departments. It's a system-wide problem pervading hospitals and indeed the response of social care and community to hospital problems. We have a healthcare system in a sense that was built for another era that's reliant on hospitals so that sometimes the shortest and easiest route of access to care when people become acutely well is unfortunately emergency departments. Our primary care system, as is currently configured, is under great strain. And it's been recognised in a number of reports now that we need to build a healthcare system that's attuned to the needs of a population that's growing, that's getting older, and that's a good thing. We've increased life expectancy. We see older people surviving diseases such as cancer, stroke and heart attack, and we need to build a healthcare system around their needs.
Okay, so it's not one or the other. Are you saying we do need more beds in the acute system, we do need more consultants, but principally we need more investment in what you call community care, primary care, social care, that's absolutely critical?
We certainly need more beds in our acute system. We provided 150 beds. It was not enough for this winter. The ESRI report, which was recently published, showed a huge increase in demand projected to 2030 for acute services and social services, the way our population is going. If our response is only to build acute beds, we will need thousands and thousands of acute beds. Okay. That simply won't happen in that time frame.
Developed an enhanced primary care system, community care system, social care system. What does that look like?
The balance of care, particularly for older people and particularly people with chronic disease, has to move back to the community where we have robust primary care, GPs working in practices, supported by diagnostics that are timely, supported by allied health professionals, and able to provide care for chronic disease and indeed many acute conditions without the necessity of falling into an emergency department referral.
Because you're a geriatrician by vocation, I gather. Would many of the patients that you would see in the acute system, could their needs be met in the community at a primary care level?
Well, the first thing I'd say, of course, many people who come to emergency departments need urgent and emergency care, which is what we call it. But the one thing they do not need is to stay on when they're ill, is to stay in a trolley for a prolonged period of time. And certainly there are some patients who, if they were identified earlier, be it in a nursing home or as they're becoming frailer in a home care setting, as has happened in Connolly and in other hospitals, in Connolly Hospital and other hospitals, where initiatives led by Dr. Siobhan Kennelly and other people have identified people in the community before they become hospital reliant and provided care and intervention to reduce dependency on overcrowded emergency departments.
So, would you put a figure on the sort of investment that we need to plough into that area? Because looking at the OECD table, we're at something like 15 billion a year total health spending. We compare quite favourably on those OECD standards.
We do on those standards, but then when you look at our capital investment, we don't compare so favourably. And the injection of additional beds into our system, the provision of enhanced social care facilities, of enhanced primary care facilities, will require considerable capital and manpower investment into our healthcare system in the coming years.
And it's how you spend the money rather than and where you spend the money that we need to maybe relook at?
Well, we certainly need more beds so that we don't face this January after January, but really what we're doing now is building a healthcare system for a new era, for a population which is ageing, which is good, who are surviving acute illnesses, which is good, and who are living longer with chronic disease. We need a different type of healthcare system, a refocus to support hospitals with additional beds and facilities, but also to enhance primary and social care.
All right, Dr. Colm Henry, thanks a million for joining us.